Good afternoon, everyone, and welcome to the final session of Development Day. My name is Michael Burling, and I am Head of Sales Queensland with the Institute, and I will be your host for this webinar. Can I begin by acknowledging the traditional owners of the land on which we're all meeting today and paying respect to the elders past, present, and emerging. Supporting a mentally healthy workplace has become the new normal. Mental health challenges are hitting employees at all levels in organisations. In the past year, a whopping 76% of respondents experienced at least one symptom of mental health condition, up from 59% back in 2019. It's not exactly surprising, given all the big picture stresses we face, but it's a stark reminder that mental health issues touch nearly all of us on a regular basis. These numbers highlight the pressing need for us to take serious action on mental health in the workplace, and that's precisely what we're here to explore today. Strategies and solutions to tackle this critical issue. It's now my pleasure to introduce the speaker, Stephanie Thompson, who is with us today to talk about some strategies and tips on supporting a mentally healthy workplace. Stephanie is the Workplace Engagement Manager at Black Dog Institute, having been an advisor and thought leader in the workplace mental health sector for over 10 years. Currently working at Black Dog Institute in the workplace engagement team, where she guides and supports workplaces in creating mentally healthy work environments. She's experienced in strategically designing, implementing, and evaluating workplace wellbeing initiatives, as well as service delivery in the mental health sector. Steph also holds a Bachelor of Social Work and Masters in Human Resources Management. By the way of housekeeping, if you can all keep your microphones on mute, and if you have any questions at any stage, please feel free to post them in the chat function, and we will cover off at the end of the session as time permits. Over to you, Stephanie.
Hi, everyone, and thank you, Michael, for the introduction. It's great to be with you all today. I know you've had a really big morning and lots of really interesting sort of key messages and things learned. So I'm lucky last. Hopefully you all get something really great out of my session. I'm sure you will. So let's get into it. So I'd also like to begin by acknowledging the traditional custodians of the lands that we are all gathered on today. I'm not sure where everybody is joining from. I'm on Gadigal land today in Sydney. I'd like to pay my respects to elders past, present, and emerging, and extend that respect to any Aboriginal or Torres Strait Islanders who might be with us today. Feel free to jump into the chat and let us know the names of the lands that you're joining us from as well. So before I get into the nitty-gritty today, I thought I'd just tell you a little bit about the Black Dog Institute. So the Black Dog Institute is a world-renowned medical research institute. We are the biggest mental health research institute in Australia. We're the only mental health research institute that really looks at mental health right across the lifespan. So we don't just focus on one area. And everything we do at the Black Dog Institute is backed by research. So you'll hear me talk time and time again today about evidence-based and about research and science. We're big on our quality assurance as well. Everything we do is delivered by experts. Our programs are people-oriented and outcome-focused. So the foundations of the Black Dog Institute are that we are born from science first and foremost. As I said, everything we do comes from research. But we're also driven by compassion. So we make sure that we listen to the people who might have lived experience of mental health issues, as well as our partners and our peers and others in the sector. We don't pretend to know absolutely everything. We like a collaborative approach. And finally, we put those results from our research into action. We don't believe in research for research's sake. We believe in connecting the dots and turning our research into practical programs and tools that can improve mental health in Australia and prevent issues before they even begin, including things like reduction in suicide and workplace mental health. At Black Dog Institute, we are for better mental health. So over the last few years, I mean, I know you've had some mental health kind of focused topics this morning as well, and I'm speaking to a group of people who are pretty, aware of some of this stuff, I suppose, but it's no big shock that mental health has become more in the sort of mainstream and more talked about over the last few years. Certainly, we've all had individual and collective experiences as a result of things like COVID, as well as cost of living, and all the other factors that go on in the world and in our personal lives as well. And so what we know is that 1 in 5 Australians will experience symptoms of mental illness in any given year. I suspect you've probably heard that statistic before, but I just really want you to take a moment to think about what that means in a real sense. I can see there's about 150 or so online at the moment. So, you know, that's, I'm doing the maths off the top of my head, but that's about 40 of us are experiencing mental distress right now, having symptoms right now. And that's really quite a lot of us as well. And that's just people experiencing symptoms. Then you take into account people, the carers, the loved ones, people in relationship with these people experiencing symptoms of distress. Mental health affects us all. It does not discriminate, although there are factors that make you more likely to have poor mental health, but it is something that will affect all of us at some point in our life. Just to extend that a little bit further, 60% of those people experiencing symptoms won't seek support or get help. 60%. So just imagine that for physical symptoms. So imagine somebody in your life walking around with chest pains, severe chest pains, and saying, I've had these really bad chest pains for a week. You would be absolutely horrified, and you'd probably call an ambulance on the spot, because that's something that we understand is necessary when it comes to physical health. We're getting there with mental health, so the conversation is started, which is fantastic, but we still have a long way to go. And that's part of why I'm here to talk to you today, to really sort of bring it home, the importance of bringing mental health into the conversation in the workplace. Talking about mental health and well-being should be part of our day-to-day life. It should be something we talk about in our home life. It should be something that we talk about and acknowledge in our social life and also our work life. And so we posed the question at the Black Dog Institute a few years ago. We asked the question, is modern work making Australians mentally unwell? So this was back in 2021. And as you can imagine and appreciate, that's a pretty complex question. There's not just a simple answer for that. Certainly work can keep people well and help prevent mental illness. But the sort of long and the short of it is that it does seem that the way that modern work is set up is causing poor mental health. And this is especially true for our younger workers. Over the last decade, Australian workers have begun reporting more mental ill health symptoms. And really, workplace mental health is an emerging public health crisis and requires immediate attention from government as well as businesses. And so how does this look? So what is the role of work in mental health and well-being? So we spend a lot of time at work. We spend a third of our lives at work. So just that alone tells us that if you're talking about population mental health, then you're talking about workplace mental health. It should seem, or does seem to me, to be somewhat obvious why we need to talk about mental health and focus on mental health in the workplace. The workplace is a key area where we are really trying to make progress in the area of mental health. And not only because it's inextricably linked, mental health and well-being, and we spend so much time at work, as I mentioned before, but really we want the community of a workplace to be informing and supporting our mental health. In 2020, the Productivity Commission released a report on mental health, and in that report they told us that poor mental health was costing businesses in Australia $39 billion. That is an extraordinary amount of money, and I would imagine since 2020 that figure has actually increased. Although the good news is that there is a strong return on investment when it comes to implementing interventions and initiatives of around $2.30 per dollar spent on mental health actions. And something we'll talk about a little bit later on is how actually some of our Black Dog Institute programs are seeing a much higher return on investment as well. So there are things you can do, even though this cost is quite staggering. So clearly, there's a financial incentive to put in place mental health interventions and initiatives and create mentally healthy workplaces. But beyond that financial incentive, mental health and well-being is something that we must do. It's actually, we have a legal responsibility as organisations to create mentally healthy workplaces. Mental health and wellbeing is covered by the Fair Work Act 2009, the Disability Discrimination Act 1992, and the Work Health and Safety Act 2011. And this states that workplaces need to prevent harm to the health and safety of workers, and that includes physical and mental health. But for some reason, even though it's explicitly stated there, mental health is often overlooked. That's also changing, and I'm sure many of you would be across the psychosocial codes of practice which have come out across most states. I believe Victoria is still yet to go over the last couple of years. So things are changing. Organisations are sort of sitting up and understand the need to focus on this, and I'll talk a bit more about psychosocial risk shortly. Okay, so there's a financial incentive to improve the mental health of your workplace. There's a legal obligation to do so. And an additional reason that we like to focus on is that it really can help your organisation become an employer of choice. We know that workplaces that invest in mental health are actually more productive and equally have a competitive advantage when recruiting good talent. If you've got a great workplace culture, if you can tell people that you've got a strong mental health focus, a mental health strategy, anti-bullying policies, you're going to be more attractive to great talent. Positive workplace culture and strong relationships and connection in the workplace is what draws people to work. It also, as I said, is a legislated requirement to create a mentally healthy workplace and to manage those psychosocial hazards. By creating a mentally healthy workplace, so you're ticking all these boxes, you've got the financial incentive, you've got the legal obligation, you've got the need to increase engagement and attract and retain employees. But also there are some really staggering stats around things like suicide that are out there. I don't have the exact stats in front of me, but the last time I checked, the statistics were something like 9 Australian people die by suicide every day. And of those 9, 7 are men. That's extraordinary and devastating. Mental health is not something that is harmless. It is incredibly harmful, or can be, and we can save lives by doing this work. And even though some of the work can feel a bit and can be somewhat complex, if we're all on board, it can make a really big difference. It's the right thing to do. So hopefully my presentation today inspires some action and really encourages you to look at how your workplace can create a positive culture that is open and supportive and reduces stigma. And one core principle to always keep in mind is that mental health exists on a continuum. So we all move up and down this continuum. We can move up and down this continuum on a daily basis. We can move up and down the continuum. For the most part, we go up and down. It's more of a slow and steady sort of progression, or we might go up and down, depending on many factors. It might be something like a pandemic. It might be something like a relationship breakdown, or it could be workplace related, stress, workload, deadlines, change. So many factors affect our mental health. But what's important to note is that we do go up and down it. And so keeping that in mind is really important when looking at and considering how you might create a mentally healthy workplace, because you don't just need to or want to focus on the pointy end of the spectrum when you've got people experiencing mental distress. We need to put in place preventative measures and protective factors that stop people from going further down that continuum. We want to support healthy workers as much as we need to put interventions in place for people who might be struggling. And I just want to make a point here around language that we use when it comes to mental health. So the opposite of mentally healthy is not mentally ill. Certainly there are times when a mental illness can be a very distressing experience. And it's probably not something that, we really want to have happen to us, but a lot of people with a diagnosed mental illness can also have really positive well-being. A diagnosis of something like bipolar does not mean that you will not be mentally well again. It also doesn't mean that you will ever not have that mental illness. So I think it's just really important to keep that in mind. And I tend to not use the word mental illness as the opposite of mentally healthy. I prefer to use the term mental distress, because that's something that, can happen to us quite significantly, whether or not we have a diagnosis. But I know that there's different sort of viewpoints around language, but I just wanted to point that out before continuing on. Okay, so thinking about that continuum then, in a practical sense, what that means is, as I mentioned, really taking a step back and considering what sort of interventions are going to be applicable across that whole continuum. So looking down this end of the spectrum, when you're looking at people who are healthy, what we're talking about there when it comes to interventions are things like, how can we make sure that the design and the way the work is managed is done in a way that will minimize harm? Also, how can we enhance and support the personal resilience of people in the workforce? And how can we promote protective factors at an organizational level? What can we do as an organization to make sure people are conducting self-care and taking care of their well-being? And then as you sort of move along the spectrum and up the continuum, you're looking at things like promoting and facilitating early help seeking. So that might be like if a manager identifies that someone in their team might be sort of acting a little bit different, the manager can make recommendations on where to seek help, calling the EAP, and also can support recovery or absence that is needed from mental illness. So what are reasonable adjustments that can be made to the workplace, and how can you support an employee to stay engaged with work? So that's very, very top line, very high level. And again, as we move through these slides, we'll be talking in a little bit more detail about this. So I'm going to talk through 6 ways that employers or organizations can support the mental health of their work environment. And some of these might sound, I suppose, idealistic, but they're certainly all very doable and implementable. And we'll talk through, again, a bit more about the practicality of things along the way. So first of all, we have got smart work design. So what work design refers to is basically, I mentioned this a bit before, but it's really, are the right people employed to do the right work? Are the job descriptions and the tasks outlined manageable? Is the pay fair and reasonable? Do people have some autonomy and say over whether it's the tasks that they're doing, the way that they're doing those tasks, where they do those tasks? So it might be in an office or from home or in, a healthcare setting, whatever it might be. Do people have the resources and the tools to do their work? It's all very well and good to give people deadlines, but they might be completely unachievable. They might not have adequate internet access or access to a CRM, or I'm being very focused on, I guess, office-based roles, but essentially really looking at the design of the work. And what you can do to improve work design is looking at how can you establish flexible working hours or flexible working settings, environments. And equally, if that's not possible in the sector that you work in, it might be the option to swap shifts if you're a shift worker, or have lunch at a different time, or anything that can make people feel like they have a say in their work. Again, addressing workplace culture comes into play here as well, making sure that people feel included and listened to, and genuinely are listened to as well. And then, of course, there's the fact of workloads and things like control and demand. So when basically people have too great a demand on them and not enough control, then they start to experience quite significant stress. So making sure that workloads are manageable. And at the moment, the last couple of years, we've seen the Great Resignation happen, and there's been quite a lot of turnover across the board. So that means that there's people or workplaces doing a lot more with less. So there really needs to keep an eye on, what's doable and how are people sort of traveling at this time. I also want to quickly mention about work design is that is probably the one area I talk to hundreds of organizations, possibly thousands in a year. And work design is the one space that people are struggling with. It's really hard to unpick and undo and unscramble the egg when things are set up a certain way. But there are strategies. I'm happy to share some of those links to different platforms and different resources after the session. Next along is building personal resilience, so providing stress management and resilience training, particularly for those in high-risk jobs such as emergency workers or workers who might be exposed to trauma on a semi-regular basis. It's also really important when putting in place resilience training or mechanisms to use evidence-based approach, so not just sort of doing a meditation once a month or doing a campaign just in Mental Health Month, but rather using things like cognitive behavioral therapy, or resilience training that is ongoing and embedded and something that people are really keeping an eye on over time. Another factor around building personal resilience, although, you know, we have moved a long way from sort of the yoga and fruit bowls thought concept of workplace mental health. We know that telling people to do yoga, as I just said, it won't cut it. We also know that mental health and well-being is inextricably linked to physical activity and diet and exercise. So promoting that can be really useful, recommending, you know, having access to lunchtime yoga, lunchtime walking, mentoring, coaching, EAP services, anything that can sort of build people's well-being up. Next, we have building better work cultures. So a lot of what I'm going to talk about today, all of this sort of overlaps with each other. We know that if you can create positive work design and therefore you will automatically really increase personal resilience, and culture will be impacted as well. But an important component of work, sort of increasing and improving work culture, is around learning how to have conversations with people that you might be concerned about, and encourage all staff to look out for each other. Providing mental health education to the whole workplace, or at least the people who have a role of influence, which I would imagine most of you do who are listening today. And part of this is around reducing stigma, normalize and speak openly about mental health conditions, talk about stress, talk about the demands on you, ensure senior staff are engaged in mental health promotion and are providing a positive and supportive and safe workplace. Another important component is implementing a mental health policy, including a zero tolerance of bullying and discrimination. Interpersonal relationships play a very big role in mental health, both from a protective point of view and in terms of causing harm. So it's a really important component as well. Number four, I've missed one, I can see. Number 4 is increasing awareness of mental health. So provide access to mental health information. If you're in say a healthcare setting, leave brochures in the kitchen about mental health, on team notice boards. As I said before, talk openly about mental health at work. Conduct mental health awareness campaigns at different times throughout the year, and include mental health programs in staff induction and development. A great way to think of it is to really incorporate mental health principles and wellbeing principles in the whole employee life cycle, right from recruitment all the way through to exit interviews as well. Then we have supporting staff recovery from mental illness. So make sure a great way to sort of look at this is around in training, provide supervisor training on how to support workers who are recovering from mental illness and stressful life events, facilitate flexible sick leave. You could modify duties and work schedules when appropriate, and just really making sure you're providing a supportive environment, that the communication is two-way, and ensure that if somebody has needed time off and is returning to work, that there's no discrimination against them. And that's how you create a culture of support and reducing stigma. And next we have early intervention. So encourage staff to seek help early. So if you as a manager identify that somebody has, changes in their behavior, changes in their performance, lead with curiosity, lead with a mental health conversation, reflect back to them what you're seeing and ask, are you okay? And really checking in with those people and get to know yourself as a manager, what help-seeking pathways are out there and what are some of the barriers to getting that help. Another point in this space is around peer support programs. So done right, peer support programs can work really well in a workplace setting. They can be complex sometimes, I have seen them done not so well, but having that's has a big impact on the culture and the conversation. And if you've got the right people in place in that peer support role, then you can really get the conversation flowing and people feel like it's a psychologically safe work environment. So these are sort of the 6 buckets and examples of the sort of day-to-day initiatives that can be done and put in place, and ways that you can really start to create a culture of wellbeing and establish a shared language around mental health and improve mental health literacy. It's also really important to note that whatever you put in place, you want it to be sustainable, you want it to be achievable, you want it to be accessible, and you want it to be inclusive. You know, if you've got, in one of my previous workplaces, we had a head office, a couple of head offices, but then we also had sort of shift work facilities. And so having lunchtime yoga in the offices is not accessible or inclusive for the vast majority of employees. So taking a really considered approach is really important. You want to make sure you're thinking of everybody. Although one size fits all isn't always possible, supporting and doing what's best for most is a good idea. I mentioned earlier the psychosocial risk factors. So basically what psychosocial risk factors are is any work-related mental health risk factor. So that can be the, factors relating to the job or factors relating to interpersonal concerns or organizational that can impact our mental health. So we've seen the changes in the legislation on this, and there's now the code of practice put in place across the different states. So this is really important stuff. It's not anything especially new, to be honest. This was always something that that organizations were required to do, but now there's going to be more accountability, and there's more of a playbook, I suppose, of how to put in place protective factors to minimize risk relating to these factors. So at the Black Dog Institute, we've sort of put them into these three categories. One is operational or team factors. So that's a little bit related to the design of the work. So things like the bullying and harassment, interpersonal issues, peer support, not having the resources to do your job, hazardous physical working environment. Then you've got the organizational factors. So that's the stuff that kind of sits, the scaffolding around it, if you like. And so that's things like policies, processes, change consultation, and poor procedural justice as well. And of course, the job factors. So these are the things that we might not have. Some things we have a say in, and others we don't. So there's some work that are occupationally inherently riskier. So things like emergency service workers, isolated roles, roles where you have to wear really heavy PPE that can be really stressful. What else? Yeah, anything that's got exposure to trauma. But then it also includes things like effort versus reward imbalance. So if someone, there's a high expectation of effort, but low recognition, and also low job control and high demand, which I touched on before. When looking at what you can do to create a mentally healthy workplace, another factor that's really important is remembering a lot of people I speak to a lot of HR professionals, chief people officers, directors. I speak to a lot of safety officers as well. And what comes up a lot of the time is that managers in their workplace sort of expect or hope, perhaps because of demand and resources, that HR will solve this problem. And when there's a mental health issue, they go straight to HR. Now, of course, HR probably need to be made aware of things, but creating and preventing mental health issues is not it's not a sort of one responsibility of one person. An integrated approach is really necessary. So this is looking at the organization, it's looking at the team or the manager, and then it's looking at the individual. Looking at everything in that sort of through that lens is how you create sustainable, achievable success in a mentally healthy workplace. So what do we mean by organizational? So that's things like, as I said earlier, that's the scaffolding, that's the policy frameworks, the processes put in place and agreed measures. It's having the CEO across it all, maybe not in every little detail, but who understands and is supportive of and is really leading that charge. It's around building knowledge and skills to influence change as well. It's things like workplace values too. And then moving down sort of a level, you've got the team and manager or people leader role and responsibility. And that's things like identifying and managing protective risk factors, so on a day-to-day level, increasing mental health and wellbeing literacy, and promoting help seeking. And then managing mental health at a team level, again, if we're looking at this at the preventive factors, so making sure that you're keeping your team feeling healthy, checking in with them, having regular one-on-ones, all of that. So I just want to point out here that this level, the management level, are really, really crucial. Although I've just said it is an integrated approach that works, managers, without manager buy-in, without managers walking the talk, you don't really stand a chance of creating a mentally healthy workplace. You can have all the policies in the world, you can build resilience at a personal level, but if you don't have managers who are confident and skilled in and literate in mental health, it's going to be really hard to create a culture that is mentally healthy. Managers are the ones who have line of sight over their people, who are noticing any behavioural change, who are having the check-ins, the one-on-ones. They're setting the tone. They're role modelling self-care, and they're the ones who are saying, it's okay, you know, this happens to all of us. They have an opportunity to be vulnerable and to really impact stigma and to give their teams permission to, you know, to attend the different interventions or initiatives that might be going on. So I think it's just, really important to prioritise manager education, skills and confidence. And then, yes, the individual level is really supporting and creating a workforce who understand what mental health is, who understand what help seeking looks like, and who appreciate that mental health and wellbeing is a personal responsibility as well. So I feel like I'm talking a lot, which of course is the point, I suppose, but I want to really go through some key actions now that you can take away, because I know that a lot of this is pie in the sky idealistic, but I want you to feel like you have the knowledge to go away and have some practical feedback. I might skip over this slide. We've touched on that for the most part. So our 5 key recommendations from the Black Dog Institute. So these recommendations come from our research. Our research team spent a long time going through the nitty-gritty and the detail with lots of complex data to come up with 5 really, I guess, palatable, simple recommendations. And the first one is providing managers with evidence-based mental health training that will improve the recognition and response to mental ill health and related factors in the workplace. So training is a really sort of great low-hanging fruit option, upskilling managers, that is. So it's a critical first step. You know, that's how you really see change. To really change behaviour, though, this training must be more than just awareness raising. You know, we want more than just what is mental health, what is depression, what is anxiety. We want skill building, and we want it to be related to manager-employee relationships. So, you know, what are some of the really training managers on how to have those difficult conversations? What are the early warning signs? What is your legal responsibility as a manager? How do you manage someone who needs to take time off? How do you help them come back to work? So really building their confidence and their skills, way more than just awareness raising, more than just a 1-hour presentation. Our research has found that skills can be taught in a single 3-hour training session. This could be done face-to-face or online. And we've seen a return on investment of this training of $10 for every dollar spent. So if you spend, you know, $1,000, you'll get a $10,000 return on investment. So it makes a lot of sense. The next recommendation is build mentally healthy workplaces through organisational level strategies that facilitate worker autonomy, improve job control and flexible work. So as I've been talking a bit about organisational level interventions, and they can be hard to implement. And especially, you know, if I'm talking to sort of line managers who might think that they don't have that influence up, but they are essential. And so doing what you can in that space is really important. These organisational interventions or strategies have a stronger, more lasting impact than individual level interventions alone. And although we are seeing that not very many businesses are doing this, you know, it's a real knowledge gap and skill gap for a lot of organisations. So we recommend businesses should implement interventions to improve employee job design and job control. So really thinking about that autonomy and having that say in the work or where the work is done is a great place to start. And then also looking, of course, at policies and adjustments around things like flexible working. And you can also do things like set up problem-solving committees or other approaches to ensure employees have more control. Something that we're doing actually at the Black Dog Institute is our fearless leader, Dr. Samuel Harvey, He is always the face and the voice of everything at Black Dog Institute, which is really fantastic. And he's a very authentic man, as you would expect somewhere like the Black Dog Institute, of course. But he instigated a project called Better BDI, and he asked everybody for their feedback on ways we could improve the way that work is done and the workplace culture. And we've all sort of voted for those different ideas, and there's a committee in place to review those ideas, and once a month there's feedback given to the workplace on what ideas are doing well, where they're at with exploring these ideas, and it makes you feel very listened to, very heard. He's continuing that feedback loop. It hasn't just dropped off. There's a committee put in place. It feels like he's really considering these different sort of options, and it's made a really big impact on engagement and, you know, feeling supported and heard at work. So things like that can work, and we're a pretty big workforce as well. The third recommendation is around taking immediate preventative action on workplace bullying, sexual harassment and assault. Having a very strong stance and a zero tolerance policy on this is really important. Workplace bullying, sexual harassment and assault are all strongly associated with adverse mental health outcomes. And even though this might seem obvious to many people here today, this goes on so much more than we know about even, and it is rife. There are so many issues. And so really looking at this and taking it seriously is a great place to start to see changes in outcome. And a lack of leadership and poor organisational cultures are key modifiable risk factors for bullying and harassment. So you can actually change these things. There are modifiable risk factors that work. We also recommend that businesses reduce barriers to confidential reporting and support worker wellbeing before, during and after the reporting process. And referring to the Respect at Work report is really important. Number 4 is around implementing evidence-based protective mental health and wellbeing interventions. So that can be things like physical activities, step competitions, September, mindfulness sessions, CBT programs, you know, apps and promoting apps. There's a lot you can do there. Black Dog Institute have a number of apps that are really effective. None of these on their own is enough, but in conjunction with the other recommendations that I'm talking through, they're a really great sort of way to boost wellbeing and prevent distress. And number 5, which is, we're sort of moving to this being less relevant, but it's still relevant now, is account for a steady post-pandemic workplace transition. There's a lot we're still figuring out in a post sort of COVID normal, whatever the right language is around that world. People are still coming back to work. There's changes all the time with different organisations changing their approach to hybrid work. We know that things have changed. We've got an increase in poor mental health. We've got an increase in hybrid work. We've got an increase in COVID and issues relating to that. And there's a lot of sort of COVID hangover mental health impacts, especially for young people. So it's really important to just slow down, listen to your workers, try different things, acknowledge when they haven't worked, provide a supportive environment with well-trained managers, and really focus on reducing stigma, talk about mental health, acknowledge that it's a hard time, you know, and put the training in place. And one of the last things I want to touch on today is the 5 ways to wellbeing, which you know, I've talked a lot about workplace mental health, and I know that most people here are a current or aspiring leader. And so it's really, really important to look after your own mental health and look after yourself. So when it comes to self-care, I think sometimes I can lose people because people go, yeah, it's fluff. But the Black Dog Institute use a scientific research-backed framework to support mental health, and it's the 5 ways to wellbeing. And it's got these 5 different factors. Connect, so connect with the people around you, your family, your friends, your neighbours, your community, your work colleagues. Connection is key when it comes to mental health and wellbeing. Push yourself out of your comfort zone. Ask someone if they want to go for a dinner or a drink or whatever it is you do, a coffee. You know, really, sometimes there has to be a bit of fake it till you make it, and really putting yourself out of your comfort zone, because connection is key. Being active, of course, as I've touched on, keep your mind and your body active. Find something you enjoy that works for you. It can be high intensity. It can be going for a walk, playing sport in a team. It can be gardening. It doesn't have to be, you know, going to the gym. It can be something in a team, something in a group. Be aware, so take some time to stop and be aware of your surroundings. This kind of is mindfulness, essentially. Really think about, and a bit of gratitude as well. You can notice the smells, the sounds and sights around you. Try practicing meditation or keep a mindfulness journal. Learning, so trying something new or rediscover something that you've done in the past can give you a sense of achievement, build your confidence, and can be a creative outlet. And then, of course, helping others can give you a sense of purpose and belonging. It can help to establish the connection and building friendships, doing something kind for a friend or a stranger. It can be as simple as sharing your appreciation, giving your time. It doesn't have to be, you know, volunteering in another country for 6 months. It can be simple. You can make a donation. There's many, many ways, mentoring. So these are the 5 sort of core principles that will help you boost your well-being. As leaders, you know, it's really important to do this and to role model this in your work environment. So that's the end of my slides. I feel like I've had a lot of slides, a lot of content. If you have any questions about anything I've talked about today, that's the email address to my team. Feel free to reach out anytime. And we can, you know, we will talk to organisations every day. Talking to one of the workplace engagement managers is completely free and easy to do. So feel free to reach out. So thank you. I know there's a little bit going on in the chat. I haven't had a look at that yet. I'll let Michael.
Thank you so much, Stephanie. You definitely deserve a glass of water after that.
I was talking a lot. I'll take a breath now. Yeah.
Look, there are a few questions coming in, and we will work through a couple of those as we've got a little bit of time. One of the first ones, Stephanie, how do you determine the difference between a normal workplace performance or employment issue versus a mental health related one?
Yeah, it's a good question, and it's really hard. And I will start by saying that I am on the board of a couple of daycare centres. I've worked in a leadership role and I'm doing what I do now. And I have never seen this done particularly well. It's really quite hard to do, even when with great intentions. I think what it comes down to is if a manager is having regular one-on-ones with their staff member, you're checking in, you're not just necessarily talking about work, you're talking about, you know, how are you doing? Have you got enough support? All that kind of thing. Then the performance starts to slip. If you've established that rapport with that staff member, you've kind of got the space to go, look, I've noticed a change in your performance. Is everything okay? Is there anything you want to talk about? So just opening it up. And if you've established that rapport and that relationship, it doesn't need to be complicated or confronting. What can be difficult is if someone says, I'm fine. You know, if somebody does not want to disclose that they're struggling and their performance is slipping, then all you can do is act on the information you've got. If you've asked the right questions and you've identified, you know, you've been curious and you're not getting that sort of feedback that actually something else is going on, then you can start to manage it like a performance issue. But I think, yeah, really establishing that rapport, leading with curiosity, assume good intent always. People are mostly doing their best, you know, but our training as well, I really didn't want to do a sales plug at all, but our manager training explores this in a lot of detail, and there's a lot of case studies and kind of unpacking the nuances around performance and mental health because they always overlap. Thank
you, Stephanie. One of the other comments was Chanel feels a bit overwhelmed with days for mental wellness. There seems to be a few. Are you okay? September, International Women's Day, Harmony Day, Women's Health Week. But has made the comments that she really loves the simple approach: connect, be active, be aware, keep learning, and help others.
Yeah, look, in terms of those health or those days, you know, they're not all health or mental health related. I guess they could be considered well-being related, things like Harmony Day. Some HR functions or some organisations just love to bring people together and have a morning tea for anything, and that's wonderful if that's if it works, if people still have time to do their job and feel like, and if there's other things going on, there's no point in having a morning tea for Are You OK Day, but then never talking about mental health ever again. So I think really, looking at what else and how are you embedding well-being into the way we do things around here instead of just having morning teas for all the days is going to have more of an impact.
Great, thanks, Stephanie. A couple more questions before we let you go. Angela has said she's lucky to have a very stable management team. How is it best to continue the freshness of mental health? Angela said she'd be reluctant to roll out the same training over time.
So I think I'm taking that question as there's good tenure in the management team. There's been some training done. What else can you do? Is that that's sort of the tone of that question?
That's what I get also, yeah.
Yeah, okay. Look, yeah, I mean, I suppose if you don't think you need to do more training, then maybe training isn't what's needed. I guess there's a number of other things that can be done outside of just training. It's that sort of it's a bit of a vague, there's a few more details that would be helpful to know. If the sense is that the management team are really skilled and confident in managing teams and creating a mentally healthy workplace, then it might be doing some other initiatives, and that might be more sort of talking openly, reducing stigma. It might be sharing personal experiences and using storytelling as a way to engage the rest of the workforce. Maybe it's training on, looking at things like bullying and harassment or sexual harassment or diversity, or sort of picking a more niche topic. But then if you don't think that the management team are as skilled as they could be, you could roll out the training again. You could just explore other providers and see if there's a different training provider who might have a slightly different option for you. But I guess it depends exactly on what training was done.
Thanks, Stephanie. And two really good questions I might roll into one here. Reema's question is, how do you connect with someone who's resisting the connection? And Alex, with quite a broad but important question. How can you normalise conversations about mental health challenges in the face of ongoing stigma?
So can you repeat the first part of the question?
Yeah. How do you connect with someone who's resisting the connection?
Yeah, great question. So if there's a manager working with an employee or a peer-to-peer, actually could be either, and you might have a bit of rapport, and then you've started to notice that there are slight changes in their behaviour, you're noticing some red flags, but they're saying, I'm fine. So as a manager, as I said before, you can only really work with what you've got. You can't force someone to disclose. I would just keep a really strong eye on someone if you're really worried about them, So let's say it's not at the really severe end that you're not worried about their safety, but you are worried about their well-being. You sort of got to respect their boundary, especially if there is no workplace, I guess, issue. So if their performance is fine, or you're not their manager and everything is fine, there's not much more you can do. But I would just be, so then I guess that's where it sort of into the second part of that question around normalizing and having the conversation in the face of ongoing stigma. So that's also really hard, and stigma reduction happens by doing the talking, and by pushing ourselves out of our comfort zone. And as leaders and aspiring leaders, you've got this great opportunity. So sharing stories is always how you reduce stigma. Communication, talking about, might not be your own experience. Not everybody's got really distressing stories or lived experience, but it might be someone you've cared for, someone, a loved one, or even in an old workplace that I was in, I think it was Buddy Franklin came out, maybe this might be like 7 or 8 years ago, but, a very well-respected sportsman came out and took the rest of the season off because of his mental health. And just even sharing that on the intranet and acknowledging that this is really brave and just bringing it to the surface and just talking about it. And I know that's probably a really simple, maybe not very scientific answer, but it's just the way that stigma reduction works. We talk about it, we normalize it, and leaders need to do it. There needs to be lived experience. There needs to be people role modeling that it's safe to share these stories here. We support you, and you will not get punished, and we believe in hearing these voices. So, and that's a leadership decision.
Thanks, Stephanie. I'm just going to refer to one of the earlier questions, which is around, there seems to be a lot on people leaders at the moment. You know, they're busy, they run off their feet, you know, and now, you know, we're talking about, you know, the mental health and what a priority that is. It seems to be a busy time for people leaders.
So the thoughts that come to mind with that reflection, and it's true, and I was talking a lot about this, particularly during COVID, you know, pushing the point of the role, the importance of the role of leaders. And it's like, oh God, there's so much on leaders, poor leaders. And I think some of these leadership capabilities and qualities that we talk about in our manager training is really focused on that preventative end of the spectrum, and actually is kind of inherent in just, I guess, what you should be doing as a leader anyway. So having one-on-ones with your team, checking in to make sure that they've got what they need to do their job, making sure that they're not overloaded with tasks, and how can you help them get their tasks done? What else do you need to do your job properly? If it is in a risky work environment, like an emergency service worker, making sure that all the, you know, supervision and all the checkpoints are in place. So this comes back to kind of work design in a way. It's sort of people leaders ideally aren't doing lots and lots of work. Their main responsibility is leading the team. And I know that's, again, a bit idealistic, but that's where you should be moving to as an organization is, you know, if managers are having one-on-ones and they're asking the right questions, and, you know, they understand what is their responsibility and they're confident enough to follow through with things, then this stuff shouldn't be too complex. Now, having said that, it is complex, and people are having all kinds of mental health issues that are nothing to do with work. So you can be the best leader in the world and having one-on-ones with your team all the time, and people will still go through relationship breakups and, you know, family stuff and cost of living and all of that. And they might come to you and want support. So, you know, you might get overwhelmed with things. And that's, you know, again, it's sort of going up the chain of what support's in place and who's looking after people there. And look, I think it's hard. I think self-care, self-compassion, good role modeling, and having frequent conversations with the right people is the best I can offer. But also acknowledging that leaders are people, and so you can only do what you can do, and you're not a mental health professional. I actually should have said that earlier. Leaders, managers are not mental health professionals. You don't need to have mental health conversations like counseling conversations. You need to have check-ins and know help-seeking pathways. Understanding really clearly what the help-seeking pathways are and explaining that to other people is the best thing you can do as a manager around mental health. You don't need to be the counsellor. That's a very important point.
That's great. Thank you, Stephanie. We will close the session here today. We look to be out of time. I want to thank Stephanie for taking time out of a busy schedule to share her knowledge with us today. It's been a fantastic session. So thanks to everyone who've joined the session and others throughout the day. You'll receive a wrap-up email with the resources from all sessions in the coming days. Please also take some time to review what's on offer at the Institute, including our leadership programs, short courses and events. And just a reminder, we have the end of year celebrations coming up, and we'd love for you to join us and network with our growing community of members. So thanks again, everyone. And thank you, Stephanie, and have a great day.